Hello, my name is Sheva Carr from HeartMath Healthcare.
And I'm Robert Browning from HeartMath Healthcare as well.
We're here actually to care for caregivers. Medscape just came out with its 2019 data on physician burnout. And it's a sober report that ignited our hearts of compassion to want to reach out and help those who help others. JAMA published a study that showed that at any given time, 50% of our healthcare providers who are physicians are experiencing burnout, moral injury, and even suicidal ideation. Medscape showed us in the 2019 data analysis that those professional healthcare providers who are most likely, given the nature of their specialty, to commit suicide or burnout are the ones that are also the least likely to ask for help. So we want to make help easy to access with zero stigma and easy to find. And that's why we're here with Dr. Beverly Joyce, OBGYN from Dignity Sequoia Health System. And OBs are among the top specialty that burn out. So Bev's going to share a little bit with us about her own journey to recovery. And we're also privileged to have Dr. Jeffrey Stewart, who is the Chief Medical Officer for Washington Hospital here in Northern California. Welcome. Thank you for both for being here. Beverly, do you want to kick us off a little bit with your own story? And
Sure. Thank you for arranging this, Sheva. So I'm an OBGYN and been practicing for 25 plus years. And about 3 or 4 years ago, when my kids were in the midst of their teen years, not yet driving and doing all kinds of athletics, I was in the heyday of my OB practice, delivering pretty much all my own patients 24/7, 365. And you know, there were days when I was taking care of my kids driving in carpool, and I would get an urgent page to labor and delivery. And pretty much that anxiety reaction began to be my normal way of life, to the extent that I was just a nasty person. I was nasty to my office staff, my family, my husband, and eventually got called out on it by one of my partners, and it made me have a shift. And I wish I had had some tools at that time that we're going to talk about to help me with those feelings of the anxiety and the dread and the burnout is basically what it was. And I feel now that I've kind of come through it, I'm out on the other side, and I want to help other physicians who are in that same feeling to really be able to deal with their situation in a more productive way.
I feel like one of the things that's so important to me to express is if you're a physician who's feeling that way, or a loved one of a physician who's witnessing your colleague or your friend or your spouse going through that irritability and agitation that you called, I forget what you said, but you were being mean and nasty or something, is because the demands are unreasonable and impossible for any human being to live up to. And so we know that systemic change has to happen, and that's one of the reasons, you know, that Dr. Stewart is here with us, because we're looking at how systems can change, but what we need to do is empower the people inside the systems to make intelligent changes. Jeffrey, do you want to add anything to that?
Yeah, I mean, just real briefly, I mean, I can fully relate to Beverly's, emotions around being in demand and on call. For about 13 years, I was an inpatient anesthesiologist, did cardiac anesthesia. And in the days when the business structure was such that it was not as well staffed as it should be, and we would be, literally, I know Beverly can totally relate to this, on call for entire weekend and be there when I had, young children at home. But my career evolved such that while I experienced that, I was able to move over to a surgery center about 13, 14 years ago. So I kind of became, I think, a little bit detached from this, even though I had an awareness of it and knew I would never forget it, of that kind of feeling of angst, but always felt very blessed to be where I was. But I got really interested in this issue and really how serious it was, learned about it 2 years ago, I had a good friend of mine who committed suicide. And it was really, while I'd been aware of physician burnout, physician wellness needs going into that, because I felt like I was fairly hooked into it, it hadn't really hit home to me till then. And really at that point, I knew I'd been in leadership positions along the way. And because of that, I learned more about it. And the more I learned, the more serious, obviously, it became to me that really something that was, to me, it was just that required attention by more than the people like Beverly who were through their own stories trying to make a difference. So I kind of felt in the back of my mind that whenever I was going to get a leadership position or somewhere I could try to affect this in some way, that I would commit myself to doing it. And then the first week I was looking into it, I met you, and I learned I was going through a time there that was quite stressful. My techniques from you to kind of help my own perspective and focus and decrease my stress, and really realizing, as Beverly alluded to, opening up my mind to other things and how it could really help people, in our situation, and hopefully make a difference, even just with that small tool. One tool at a time is kind of the way I looked at it.
Thank you so much, Jeffrey. We want to provide physicians with tools to help the helpers. And so as part of this kind of public service announcement, if you will, we are actually donating to anyone who is a physician or the loved one of a physician who feels distress to anonymously be able to access our entry-level course at no charge, just as a gift back to you for you giving your life to others in their service. So under this video, there's going to be a link where you can anonymously request access to 5 webinars at no charge, no strings attached, because we want to help you. So these are basic heart math tools. And one of the reasons they work really well in healthcare contexts is, first of all, because they've been well researched. There's a lot of peer review research. They're evidence-based. And so it speaks to those of us who have healthcare backgrounds, but also they're tools that are designed to be used on the spot. So for example, when a patient is coding, we can't very well say to the patient, you know what, you and my kids are stressing me out. I'm gonna go have a glass of wine. I'm gonna go do yoga. I'm gonna go talk to a friend. I'm gonna take a nap. I'm gonna do some shopping therapy or whatever it is, or play golf. And then I'm gonna come back and I'll handle your code. We can't do that as physicians. And that's one of the reasons that our stress accumulates over time. And so these tools are uniquely designed to be able to be done on the spot in the midst of the stressor, and basically help us self-regulate our autonomic nervous systems through emotional and heart rate variability self-regulation. We're not going to go into all of that detail here. We'll gift you with that. But that's why they work well in a healthcare context. Bev, anything you want to share about your experiencing applying heart math science in your own journey to recovery from burnout?
Well, it's very interesting. My other passion, as you alluded to, was golf. And one setting that I learned how to use heart math was actually on the golf course too, with some instructors who I met at a clinic, and they are instructors for some of the top PGA and LPGA players, and they've actually taught them how to use heart math techniques in regulating their emotions and regulating their games. So I do use it that way, but I definitely do also use it professionally and personally, and I find that I just don't get as worked up anymore over things if I can catch myself in the moment, starting to kind of feel that rise coming up in me. I just do some of the heart focused breathing. I bring in that feeling of appreciation or care or belonging, and it just kind of turns me around. So it's been very useful.
I think one thing that's really important to acknowledge here is, in some of the Medscape data even that just came out recently, we know that one of the drivers of physician overload is electronic medical record. It's a huge driver of it. In fact, a series of the physicians that I spoke to about this said they went from being able to chart patient notes in 5 minutes for a recurring visit to now it takes 40 minutes using the electronic medical record. That's just increasing the length of hours that physicians are in the office and not having work-life balance. And the data shows that the longer a physician works hourly, weekly, the more burnout there is. That's like so logical. So we know that systems have to be addressed, but I'm wondering, Jeffrey, if you want to say anything as we're bringing the video to a close about how HeartMath also helps us access our higher intelligence and our ability to communicate. So it makes us as physicians better advocates for systemic change.
Yeah, no, I think that what I find, even in my short time in my job now, is that the initial reaction to anything in medicine, and I know, like, working in a real acute care setting like I did and like Beverly does, I mean, things can, change on the fly, and people can get agitated for a second or short just because of what's going on. But I can understand it in that setting. But then in my current role, dealing with kind of behavioral reactions of people, whether it's frustration for whatever reason, how you're treated, what you're dealing with. I mean, it's that same, I see it because I know I experienced it when I would have low reserve. In those situations, you would just rise to the surface and it would be angst immediately. And what I found, exactly what in my own experience and what Beverly was describing, I think is totally relevant to healthcare, because it's such a kind of high stress area, not just for physicians, but I think all clinicians really, and everybody, with the pressures of cost and safety. And what you're alluding to is having a tool to, like, I notice, like, now if I feel myself if I catch myself, just as Beverly described, it's really interesting that I've had a similar experience. If I catch myself going there and, I calm myself down, as we talked about, and one thing I have trouble with is not worrying about my daughters too much, right? And so I feel myself maybe going to this place, and I do my HeartMath, and it's really interesting. And I think it's just made me more mindful of my reactions one way or another. I thought I always was fairly mindful, but I think now with something like this, I can be even better. I can kind of there's been a few times already where I can take a moment, like in my office, and do a little bit of breathing, and then make the phone call, or then talk to somebody. And I'm sure I'm much more effective that way. And problems get, some problems, it is what it is, but you can, I think, if you have everybody on the same page, I've seen it in small, areas, make things better, or just getting people in the room to talk is, much more challenging than I ever would have anticipated from my life, all these years at the surgery center, but it's all coming back to me.
One thing I'd love just to emphasize with all of this is it's how important, this is not to say there's main things that need to change, our systems, our structures, our methodologies, things that can help move our systems and move more humanity through how the physicians and the caregivers and the patients are all being treated, while technically taking care of the skills needing to be administered. So these tools will help care for not only us, to bring us the energy and the resilience and more of the fulfillment and the purpose of what we do, but at the same time, with that extra energy, it will help us be voices and more with clearer thinking and innovation and creativity on how we change the systems. So it starts here, so it can help not only change ourselves, but and meet those demands, but help change the systems as well. So it really is a gift for you.
And I think that's the heart of it, being a healthcare provider myself. These tools don't just help us overcome our stress. What they do is plug us into our calling. And what the science shows is that human caring actually facilitates resilience in our system. And so all of you who chose to be caregivers made a good choice. It's just a matter of learning to master that eye of the needle mastery it takes to be in authentic caring and not over care, where we care so much, either about too much or care too much about one thing, that we're throwing ourselves out of balance and don't realize it. And these skills help us do that mastery inside our own physiology. So there are links below to access free online classes, or even if you'd like a complimentary consult one-on-one with one of our coaches. We're here definitely to thank you for being caregivers and to help that be fulfilling for you rather than draining. Bev and Jeffrey, anything you want to say to complete our time together on this video?
I so appreciate you doing this, and I just want to emphasize that personal resilience is only just one piece of the whole burnout issue. Obviously, we need to engage our senior leadership, and that's where, you know, Jeffrey comes in and other CMOs of hospitals, as well as creating that culture of wellness so that we can all talk about it and it's not stigmatized. And you know, we don't want our colleagues committing suicide and leaving the practice of medicine. I mean, we want to support them.
Thank you, you too.
Yeah.
Yes.
No, and I would just say, I mean, obviously I agree with everything everybody said. I also want to thank you. And I was lucky to be seated at your table at dinner, and it's really worked out well, I think, for me with respect to that. And also that what I've realized also, you know, at this point is that you really need to develop a systemic plan, depending on where you are, how you're going to, you know, move the needle at all, because I think you can overplay your hand and kind of get pushed back. And I'm really, you know, trying to, there's a lot of low hanging fruit, but as Beverly says, I mean, to really affect change, you've got to do more than that. But so that's, you know, I think that's where I think a lot of thought has to go in, and it's probably really individualized to whatever your setting is. It's going to be different where I am, you know, than Stanford, obviously, or Dignity. So I think, but the more awareness about it, like the fact that I've been able to educate myself over the last, you know, 3 years, based on just the resources and information, you know, conferences, people getting together, talking about it. I think that's where, you know, change starts from, you know, good ideas from those people getting together and talking about it.
Just like us here. That's
Yes,
why.
exactly.
That's why we're doing this.
I wasn't trying to plug it, but yes.
To start change, and we welcome you to join us to be a part of the change of heart that changes everything. Thank you so much.
Thank you.
Thank you.